So good evening, my dear doctors. Today's topic is neuroreceptor. Okay, so these receptors are present on the skin, and in the exam, they can ask a full question about the neurocutaneous receptor. So whenever we start from the sensory physiology, okay, everything starts from the receptor. So first, suppose someone is touching me here, but I will feel in the cortex. So everything starts from where? Receptor, then afferent, then ascending tract, and then the cortex. We know that. So sensory pathway starts from where? Receptor. So today in 10 minutes I will discuss about the receptor. There are actually four types of cutaneous receptor. Two are in the superficial epidermis called as Meissner's corpuscles and Merkel corpuscles. Okay, so Meissner's corpuscles and Merkel cell. Meissner's corpuscles and Merkel cell, and two are in the dermis deeper, Pacinian corpuscles and Ruffini ending. So first of all, remember four neurocutaneous receptor. One is Merkel, Meissner's, Ruffini, and Pacinian. Now, Meissner's and Merkel, remember that both are for touch. Both are for what? Touch. But both have different type of touch. Like Meissner's corpuscles are for low frequency vibration. They are mainly for what? Low frequency vibration or lateral touch, lateral motion. Suppose you want to feel the texture of a handkerchief, okay, or any cloth. So when you want to feel the texture, is it a cotton or terracotta, you do like this. So when you are doing like this, you are doing lateral motion or slow frequency. So which receptor on your skin is responsible for lateral motion or low frequency vibration? Yes, doctors. Answer is Meissner's corpuscle. Very simple. Number two, Merkel disc. Suppose if I am putting my hand on the pointed needle or pencil or a knife. Okay. So when you are putting your finger on a pointed object or some edge or corner. So whenever you are putting your hand on a pointed object or a corner or a edge, which receptor will be responsible, doctor? Then answer will be your Merkel cell. Merkel cell. So Meissner's corpuscles and Merkel cell both are for touch. Okay. But please do remember Meissner's corpuscles are for lateral motion or slow frequency vibration. And Merkel discs, they are for pointed object like edge corner, okay, and they are also responsible for 2 point discrimination, 2 point discrimination, as well as braille technique. You know braille technique? When a blind person tries to read, I mean, they have different books, they will touch and they will start reading that. So while touching, okay, who will let them know what is written in the book? Answer is Merkel disc. So I hope you will not forget. Meissner's is for lateral motion. Meissner's is for slow frequency vibration, low frequency vibration. On the other, Merkel is for pointed object, edge, corner, for braille technique and 2 point discrimination. They are very, very important for your Viva, for your MCQ, and for your full question as well. Okay. Now, Pacinian corpuscles, they are deeper, like Ruffini also. And Pacinian, you can see, shape is of onion. Pacinian corpuscles, they are having shape of onion and they sense high frequency vibration. They sense high frequency You should not forget these four receptors on your skin. Two epidermis, two dermis. In the epidermis, Merkel and Meissner's. And both are for touch. But Meissner's corpuscles, they are for lateral motion. They are for slow frequency vibration. On other hand, Merkel is for mainly pointed object, edge, corner, two-point discrimination or braille technique in case of blind. So blind people are reading by braille technique. And Pacinian, you can see the shape is of onion and this sense high frequency vibration. Roughly is for stretch and constant pressure. Okay, so this is about the name of receptor and their function. One more thing I want to add here. There are two type of receptor. One is called as rapid adapting receptor. One is called as rapid adapting receptor. One is called as simply rapid adapting. They adapt very rapidly. They adapt very rapidly. Or also called as phasic receptor. Also called as phasic receptor. So rapid adapting receptor called as phasic receptor. Second variety is called as slow adapting receptor. Slow adapting receptor, also called as tonic receptor. Now it is looking very confusing, but I will give you simple mnemonic to remember. Okay, so out of these four, which one is phasic receptor? How to know? Just remember, if at the end they have capsule, they will be rapid adapting receptor. One is called as Meissner's capsule, and other is called as Pacinian capsule. I've taken a full 1 hour lecture in the main video, but today I'm going to glimpse the must know points regarding this diagram. So how to remember which one is rapid adapting receptor? Just see at the end if they have capsules like Meissner's capsules, like Pacinian capsules. Okay, so these are rapid adapting receptor. Rest other are tonic receptor. Like what? Merkel cell and Ruffini end organ. So by remembering this simple mnemonic in the exam, you are not going to forget this. So once, let me recap everything. There are four receptors. Two in the epidermis, M and M, Merkel and Meissner's. Two in the dermis, deeper, Pacinian and Ruffini. The superficial are mainly for touch, out of which Meissner's is for lateral motion or low frequency vibration. Merkel is for touch but pointed object. They are pointed. Pacinian capsules are for high frequency vibration and Ruffini is for stretch. Okay. Now there are two types of receptor. One is called as rapid adapting receptor or simply phasic receptor. Rapid adapting receptor also called as phasic receptor. How to know? If at the end they have capsule like Meissner's and Pacinian, they will be rapid adapting receptor. Other two, Merkel and Ruffini, are slow adapting receptor. Okay. So this is it for today. Except one more point. For pain, we have free nerve ending. We don't have receptor, we have free nerve ending for pain. So for touch, we have four receptor, and for pain, we have naked wire. In detail, it is called as TRP and all those things. I will discuss in detail some other day. But remember, they are free nerve ending. And these are four cutaneous receptor. So this is it for today. See you next Monday, as we are discussing every Monday and Friday. Till then, bye bye. Take care. All the very best.